Hello, I'm Jennifer Coons, one of the reference librarians at the Haverford Township Free Library, and welcome to today's COVID-19 check-in for May 7th. The past couple of weeks we've been talking about the virus, SARS-CoV-2, which is the virus, and COVID-19, which is the disease that results from the virus. And today I thought I would talk about how the virus is being reported and the news about the virus and looking at the context of these news stories a little bit behind the scenes. As a librarian, this really interests me, and traditionally librarians have been both curators and gatekeepers of information. These days, we are no longer gatekeepers. Most people can access reams of information whenever they want to from their devices or computers, via social media feeds or online news sources. So my job as a librarian is more to look at these sources critically and come to the conclusion as to what is going to be most helpful for people, so that you can make your own decisions based on what you're seeing, and you're not necessarily being driven or manipulated by things that are coming out in the news. So the situation that we're in now contains multitudes of uncertainties. I mean, the word uncertain really describes what we're dealing with here. It's unfolding on a weekly, sometimes daily basis, with new information, new discoveries that are coming out, not only about the disease and the virus, but also about public policy decisions being made around that in terms of phased reopenings, for example. Now, traditionally, when scientists do research, it undergoes a process called peer review, and that's the process by which research papers and articles are scrutinized by others, experts in the same field. So, for example, coronavirus researchers, and there is a subset of these people who are coronavirus researchers who really nobody paid attention to for a long time, and now they're paying a lot of attention to them. So let's say a group of researchers did a research study about something, testing or antibody testing or mask wearing, I don't know, whatever it was, and they wanted it to be published before this health pandemic came up. They would submit their research to a group of coronavirus research experts, and those experts would decide. They would impose certain standards and criteria, and they would decide if this research was valid, if it was performed rigorously enough, and if it was legit, basically enough to publish. Well, now, because we're in this global health crisis, peer review standards have been they've been loosened and largely they've been done away with. And this is a good thing in a lot of ways, because it means that information can be shared freely on a global scale. There can be more opportunity for collaboration, more problem solving. And on the other hand, it means that a lot of things are being uploaded. So what happens is it's being shared electronically on a public server, and it becomes a permanent part of the scientific record. So, like I said, it can be a good thing, and also maybe not so good, because no standards are being applied necessarily to what's being uploaded to that server. It doesn't mean that anyone, like I could do some, I don't know, like anecdotal thing about herbal treatments and then put it there, because I'm not a professional. Like, you have to have a background in science and some credentials. But it does mean that all kinds of different things are being added to this server, and that debates happen. Sometimes there's disagreement. Sometimes there'll be one thing that comes out, but it turns out that it's not necessarily true. And examples of this are like, let's say, the drug remdesivir. First, it was thought that it might be helpful and it might provide hope, and then it came out that there was no real scientific data to support that it was helpful in treating COVID-19. And then just recently, there were some clinical trials that showed that it was helpful if given soon enough in the progression of the disease. And I'm sure that in a couple of weeks, there'll be something else that's new. And this is just how the scientific process works. It just usually happens behind closed doors. It's not on public view. So when we see this happening, we think, what's the matter? Or don't they know what's going on? And well, they do. They're experts, but they're just researching this all in real time. And this is, like I said, it's how science works. And there was an article I read in The Atlantic about this, and there's just it's a little bit of a quote, a paraphrase. The scientific process is more of a slow, erratic stumble towards ever less uncertainty rather than a parade of decisive blockbuster discoveries. And scientific debate has always been a part of this. So that's why, we see, like I gave the example of remdesivir, there's also the vaccine thing. First it was like, maybe we'll have it in 12 to 18 months. And then it was, well, maybe it'll be closer to 4 years. And then now we're back to 12 to 18 months because there's this new technology, which is very complicated. It has messenger RNA. I don't know. I'm not a medical expert, and that could then change. Next week, there might be some new information about that. So what else do I have for you? So anyway, so you have these public servers with all this information, and journalists and health writers, we all hunger for more information, and it's the job of health writers and journalists to get this information and create articles that are understandable for the layperson. So you can find these articles on magazines, newspapers, radio shows, podcasts, usually electronic versions of these things. And also, what I want to talk about more today, though, is social media feeds. And so oftentimes there will be an article that's written, and then you will find that article because someone will post it on their Facebook page, or they'll share it with you, or they will retweet a portion of the article. Twitter is full of snippets of articles or news stories, and little fragments that'll have a video or an image attached to it. So you're not actually getting the article from the original source of the person who wrote it. You're getting a repost, you're getting a share. So in terms of Facebook, let's go with Facebook for a minute. Facebook a couple of days ago actually took down about 1,800 fake accounts. And this is something called a coordinated inauthentic behavior, or CIB. And Facebook is continually monitoring this kind of thing. And what happened was, with these accounts, is they were these fake accounts. Some of them were foreign, some of them were based in the United States. And they were sort of fake accounts, and the fake account people were spreading coronavirus conspiracy theories and also bogus cures. They were posting racist diatribes against Asian Americans. And so these were removed. It's probably it's like a whack-a-mole situation with Facebook. So, but again, I mean, they're trying to monitor it. But just to say that this is a thing that happens, and just a brief foray actually into conspiracy theories, which I mentioned. So, people who attach themselves to conspiracy theories, it's primarily because there's uncertainty, and right now we're in this real uncertain time, so it breeds more conspiracy theories, because conspiracy theories imbue a sense of finality and a black and white, and it helps people to feel actually weirdly more secure, and gives them a sense of control, maybe. And with conspiracy theories, you'll have a common denominator. So for example, this idea that 5G technology is related to the coronavirus spread has to do with timing. The two just happen to happen around the same time. 5G technology was rolled out around the same time that coronavirus became a pandemic. And just to debunk this real quickly, 5G technology is made up of waves and photons, and coronavirus is a biological entity made up of nucleic acids and proteins, and those things, nucleic acids and proteins, cannot travel in waves and photons In addition, the 5G technology was not in, coronavirus was being spread in areas where there was no 5G technology. So just a quick debunk of that particular conspiracy theories. There's so many others that I could do a whole talk on, but I won't do that right now. So back to this social media, getting your news from social media. And a term I would like to also offer up, which is this concept of information hygiene. So information hygiene is a term that actually came about 20 years ago, having to do with the fact that we are constantly scanning a large area of information and trying to make sense of it. And we don't want to miss anything. And so this can sometimes make us more productive, but it can also create a lot of overwhelm and overstimulation, which is what's happening with a lot of us now, with all the information that's out there. So in terms of information hygiene, so kind of think about it like we practice good hygiene habits right now, especially. We're washing our hands real carefully, and that keeps viruses, bacteria, and germs from infecting us and making us sick. Now, with information, we want to be careful about what information we're actually letting in our brains for long periods of time, and we want to be careful about the information we're going to spend a lot of time looking at, because that can make our thinking a little bit sick and not as clear and healthy as it can be, especially when we're trying to navigate through an uncertain and complicated subject like this pandemic. So what is this so false information or misleading information? What do we call that? I prefer not to use the term fake news, because I feel like it's become, it's sort of overused, and it's been used over the past few years by people who just use it when they don't like what's being reported or if they don't agree with it. But there are two terms that I like to use, and one of them is misinformation and the other one is disinformation. Misinformation is false information that has been reported unintentionally by mistake. For example, a couple weeks ago in one of these talks, I mentioned the number of deaths and the number of cases of COVID-19. Number of cases of COVID-19 and deaths related to COVID-19 in the country. And I accidentally actually reported numbers that were global instead of just national, and realized that after I had made the recording, actually in the middle of the night after I made the recording, and it, as a librarian, it was a horrible thing for me. So, but as soon as I figured it out, it wasn't intentional, it wasn't meant to mislead you, and I actually corrected it by posting on the Facebook comments section the mistake. Okay, so disinformation is meant to intentionally mislead, and it's designed by its creator to do several things. It's designed to harm either a person or a group of people or sometimes a whole region. And it's also designed to invoke a strong emotional response. Because when we have an emotional response to something, we don't think clearly anymore. And it kind of makes people want to act in some way. Either they immediately want to share, to retweet, or post this and share this whatever it is with somebody else. So that is misinformation and disinformation. So just being aware of these things is important. There's also a lot of tools out there as to how to navigate through this tidal wave of information and all kinds of misinformation, disinformation, and actual information. And the factual information, as I said earlier, can also be confusing, but at least it's not meant to mislead. And if there are mistakes, they are corrected. And you'll find that in the most reputable newspapers and journals, they will have little areas that are correct or specifically for corrections. So I'm going to talk a little bit about, I'm going to give you a brief overview of this digital information literacy expert. His name is Mike Caulfield, and he teaches at Washington State University, Vancouver. And he's authored a book called Web Literacy for Student Fact Checkers. He's very, very active in this information literacy movement. And he has this cool blog that talks about and illustrates how to navigate through particularly Twitter and retweets, and how to kind of find out what's really going on behind little news snippets that are retweeted. I'm just going to give you a brief overview, and at some point in the future I'd love to do a screencast and take you through the blog and show you his, how he really does things. But so the first thing is to try to be intentional about your intake of news, and particularly about coronavirus, to be intentional. So that means not passive. I don't know how many of you have news feeds that, or like alerts on your phone or device that where the news pops up at you. And then if you tap on the news story, you're going to read the news story, but then there's going to be all this other news stories that are embedded in there. And then at the bottom of the news story is going to be like, if you like this, maybe you'll like this other news story. And you can get drawn, this is very passive, you can get drawn into a vortex of sorts. So it's helpful to think of maybe a question that you have about the virus, or about like vaccines, or about vaccine development, or about treatments. And you can just put a query into your search box, remdesivir, COVID-19. Just put that in, and you'll get somewhere around 300 million results. And just scroll through the results first before you click on anything, and look closely at the source. Or you can just click on a source and then look up at the top and see if is it a newspaper, is it a traditional newspaper that's been around for a while that has some journalistic integrity, what is the source? Next, and generally speaking, a news outlet that's been around for a while will have standards in place. If they make mistakes, they will then publish the corrections for those mistakes the next day. So if you see a story that maybe you have some doubts about, try to find the original source of the story. So let's say, I'm talking about if you see a post on Facebook, if someone posted something or shared something with you on Facebook or retweeted something, try to find the original source of that information. Like, sure that the guy who retweeted the chart or the graph said that it means this, but who made the graph originally? Where did it come from? And what did the creator say about what the information on that graph or chart? Social media feeds can be a little bit like a game of telephone. With each iteration of a news story, the facts change a little bit, and then at the end you have this kind of wonkiness that doesn't have much to do with the original source. So it's always good to find the original source of the story. And then the other thing you can do is kind of confirm the story by reading laterally, that is, reading about the same subject across a variety of sources. So if you wanted to know, say, about vaccine development, you could start with the Wall Street Journal. And then if you have a question about something, you can then go to the New York Times and see what they have to say about it. Then you can go to the CDC website and see what they say about it. I find that maybe instead of going to newspapers, that going to a public health website or a health-related website, usually affiliated with a university, I would say, or a research institution, a well-known research institution that's been around for a while, or the CDC, going to these sites can answer a lot of questions. And those are usually a little better than going to a newspaper. So reading across sources is helpful too in that way. And I'm going to end here right now. I hope that I have helped you and not confused you more. In future talks, I think I might like to show you some of the sources out there and how to navigate through them. For example, the CDC website is a great one. There's a lot of information that can be overwhelming, but I can show you like how to navigate through that in a way that is not overwhelming. So I hope this has been helpful. Let me know if you have any questions. You can always call 610-446-3082 and leave a message if you have any questions about health information, health news reporting. I'd be happy to help you understand better. You can also post any comments you'd like to post. So stay well, try to practice good information hygiene, and I will talk to you next time.